So hello, this is Dr. Waklinski again here, and would you mind introducing yourself?
I'm Adriana.
Hi Adriana. I know you've been a patient here for a short period of time. How long would you say that you've?
About a month.
About a month,
Yeah.
and okay. And how did you find out about our office here?
It was by chance. A patient of yours happened to run into my husband, and they started talking, and the way she was describing herself and everything she went through, he was like, "That's my wife. What are you doing that is helping you?" Because I was at rock bottom. So she was like,
When you say rock bottom, could you describe that? What were some of the issues you were having, some of the problems?
I was just a miserable person because I always felt sick.
Mm-hmm.
But I looked fine, and everybody thought I was fine, but I couldn't describe how I felt. I was tired, irritable, my stomach always hurt, my thyroid was off. It just didn't feel normal.
Mm-hmm.
And it was so long that I didn't even know what normal felt like.
Mm-hmm.
About
how long would you
over
say?
A decade.
A decade,
Mm-hmm.
Okay.
And it was just getting worse.
And had you seen a number of different practitioners over that time?
Yeah, absolutely. I have my endocrinologist, my gastroenterologist. The last thing was going to find like a psychiatrist because I thought I was crazy at that point.
Okay.
But I'm
And
not. You guys believe me.
Absolutely. Yeah. And so, in about a month's period of time, what are some of the successes that you feel like you've had here so far?
I feel like I haven't weighed myself.
Mm-hmm.
I feel like I look 10 pounds lighter just because I'm not inflamed. Like, I'm not puffy, my face doesn't look swollen, my body doesn't feel swollen. I feel comfortable in my skin. My stomach doesn't hurt anymore. I used to look like I was pregnant all the time. Even if I didn't eat, it was still always bothering me. So I was afraid to eat because if I ate, it hurt. But then if I didn't eat, it hurt. But now I feel great. I feel like I did when I was like 15.
Is that right?
Yeah.
Wow, that's great. And how have you found some of the recommendations that we've made here in the office for you? Difficult or easy, or how would you rate it?
I mean, at first, I would say the food was overwhelming.
Mm-hmm.
Only because you don't realize how much junk you eat and how much processed food you eat and how much extra sugars until you have to cut it out.
Mm-hmm. And
you almost feel like you go through a withdrawal. Like your body is like, wait, like I don't want to eat this. Like, where's the stuff that I want? Like, you crave it. But I would say the first week was tough. Now, I don't think I'll ever go back to eating the way I did before.
That's great, and that's a very common response that people have.
Yeah,
you know.
My family's now eating the way I eat, so I just feel like it's been great for everybody, and they're enjoying it. It's not like it's a forceful thing. We're all really enjoying the way we're eating now.
And so, if you were suffering for a decade, you must have been feeling like really in a downward spiral and kind of losing hope that you've been to so many different practitioners.
Yeah.
How's your outlook now for the future and for your health and so on?
Well, before I would cry to my husband and tell him I don't see myself being 60.
Mm-hmm.
I just don't see how my body will make it that far. Now, I feel great. Like, I'm looking forward to the future because I don't see myself going on vacation and being sick in the hotel room or wanting to do things with my kids but being too tired to get off the couch. Like, there is a future. I feel like I'm actually going to be who I always wanted to be but couldn't because I just didn't feel well.
Wow, that's fantastic. I mean, we're so happy to hear that. Really. Okay, so, and finally, would you recommend to our office other people that might be experiencing the same
I tell
thing?
everybody who will listen to come here. You know, it's worth it.
That's great.
I would pay triple. I, without a doubt, would come here. I don't even want to stop. Keep me forever.
Okay, well, Adriana, thank you so much. We're so happy for the success that you had so far. We look forward to even greater successes as you move through the program.
Yeah,
Very welcome. Thanks.